Mhm. Hello, this is Dr. Trivedi, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Hugh Jackman and I'm 35 years.
Okay, how may I address you?
Please call me Hugh.
Okay, Mr. Hugh. Today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
And during our discussion, I might take down some notes, which will be strictly confidential. Is it okay?
Okay, doctor.
Okay. Mr. Hugh, I have come to know from your GP that you are planning to travel to USA. Is this right?
Yes, doctor.
Yes, and you also have some issues with your blood channels previously. Am I right?
Yes, doctor.
Okay. If you can, it would be better for me if you could tell me more in details in your own words. What happened to your blood channels?
About 7 years ago, doctor, I went to India and that was the 11-hour flight. So after landing to India, the weather was so warm and hot. I really felt exhausted at the time. I was so much dehydrated at that time also.
Mhm.
And when I
Mm.
reached at the hotel, I noticed that I have some funny sensation on my right leg. And
Mm.
I took some rest, and after 3 or 4 hours, I also noticed that my leg is getting somewhat swollen,
Mm.
and there was
Mm.
a little bit pain on pressure at the time.
Mm.
I thought that it will go away because I was once sitting on the plane for a long time, so I may have some problem due to pressure. But this
Mm.
didn't go away, and so I needed
Mm.
to take an urgent advice from doctor over there, and they diagnosed me a thing called DVT, and they gave me some injection on my skin, and after that they gave me some medication to take, and I took this for 1 month. And
Okay.
I was in India for about 10 days. And even after coming to my country, I took those medication. That was total 1 month. I was totally fine at that time. After that, I didn't have such type of problem because I didn't go anywhere for so long. And now I am willing to travel to USA. And that is also a long distance flight. And I am being worried because my brother had this DVT 2 times. My mother also had a stroke, and also my grandmother has this DVT. So you can call that this type of disease. It runs in family, and I don't know that why this is happening. And I am planning to travel for my business purpose, and this is really important for me to travel. And at this, if you can give me any precaution or any medication that can help me, so I am here.
Yes, yes, yes. I will try my level best to do whatever is the best for you. May I know that when you had that condition, that DVT, okay? At that time, did you have any problem in your chest, any chest pain or any cough?
No,
Okay, any bleeding coming out from your throat or cough, anything like that?
no.
Okay, and did you undergo any scanning of your legs when you had that condition?
Yes, doctor. They did a that is called ultrasonogram of
Okay,
my leg and ran some blood test. And after that, they said that this was a condition called DVT.
that's all right. That's all right. And may I know that at that time when you had the DVT, did you have any raised temperature? Can you remember?
No, doctor, I cannot remember
Okay.
so much because I was exhausted after the long journey, and on the weather
Yeah,
was
yeah, yeah.
so hot and warm that I cannot even remember much of these events during that time.
Okay, okay, that's all right. And okay, and may I know that did you to reveal to them, the doctors there at the time, that there were some family history of such diseases in your country, in your family?
I actually went on a emergency department, and this wasn't insurance coverage, so the paying was high. So I just tried to get an improvement. Not I wasn't ready to undergo so much blood test, so much scanning test, because that was so much costly.
Okay, that's all right. May I know now that after that travel to India, have you ever been to any travel again?
Not for this long
Through air,
distance, but for about highly 3 or 4 hours.
through air or
No,
through? Okay,
through
not
land,
through air. Okay,
on land.
okay, okay, okay. And may I know that now at this moment, do you have any raised temperature?
No, I am completely fine.
Okay. Well, do you think that you have any loss of weight in your body?
No,
Okay. Any okay. Now, do you have any cough,
no,
any chest pain,
no,
any throwing up blood from your throat
no,
or
no.
cough? Okay. What about your water work nowadays?
Fine.
Okay. And have you ever noticed any blood in your water work?
No,
Any tummy pain?
no.
Okay. And how about your bowel movement? Is that all right?
Yes, doctor.
And may I know that have you undergone any surgical procedure, any operation recently, within 1 or 2 months?
No, not recently, but I had fracture of my left hand, and that was about 15 years back.
Okay, that's all right. Since then, you haven't had any operation. Am I right?
Yes, doctor.
Okay. Have you recently been hospitalized for any reason?
No,
Okay. And okay. May I know that do you now feel any pain in your legs?
no,
Okay. And any cramping or when you walk or something like that?
no.
Okay. And okay. And well, you told that so your mother and your brother had some similar incidences, and also your grandmother. After coming back from India, in the meantime, have you ever gone visited any GP regarding this matter or any other doctor?
Doctor, I didn't feel any problem, so I didn't visit any doctor after that.
Okay. And okay. Uh, and well, and actually, uh, may I and so may I know that what do you do for your living now?
I am a businessman.
Yes. And well, how is your lifestyle? Do you have to work at office days or do you have to move a lot? Can you please tell?
No, just regular office work. I don't have to sit for a long time.
All right. And may I ask you some other questions, for some personal questions? Do you smoke?
Yes, doctor.
May I know how many sticks for how long?
About 5 sticks, especially when I feel stressed, I smoke. That is about maybe about 10 or 12 years.
You're not 12 years. Okay. Okay. Actually, smoking is very injurious, and sometimes this smoking can also add to your condition. Okay. So it's highly recommended you stop smoking, and if you need, we can refer you to smoking cessation clinic. Is that all right?
Okay, doctor.
May I know that do you drink alcohol?
Occasionally.
Okay. Do you know the safe limit of alcohol? May I know?
Yes, doctor.
So can you please tell me how many pints per week you take?
Not pints. I drink occasionally, and not more than 20 units a week.
Okay, actually, 20 units can also be at times quite more. So it would be better if you cut down your alcohol consumption, and if you want, we can refer you to alcohol cessation clinic. Will that be all right?
Okay.
And may I know? I'm sorry to ask, but may I know that do you take any recreational medication?
No.
Okay, and do you have any known medical condition like that, high blood pressure or high blood sugar, anything like that?
No.
High blood cholesterol, anything like that?
No.
Okay, are you on any medication? May I know? Hello?
No.
Okay, any allergy to any medication?
No.
Any over-the-counter medication?
No.
Okay. And may I know that whom do you live with?
My wife and I have a children. I have two babies, and they are about 4 years. Twin. Yeah.
Okay. And may I know that I'm very sorry to ask that, but may I know that have you ever had any casual relationships?
No, never.
I'm very sorry to ask, but I have asked this. Well, and now may I know that what specifically your concern is, or what do you specifically want from our discussion?
Actually, doctor, I am totally fine, but I am being afraid that if I have this type of symptom again, because I heard that the DVT can develop after a long flight. I am afraid of that.
Yes, I can get it. And actually, I'm sorry to say that, but much of your fear is actually true. Regarding that, you have a long family history of such type of symptoms, and also uh, you there is also some risk factor with you, like you have been accustomed to smoking for quite a long time. So actually, these things can uh, contribute to this problem along with the long flight. Okay, so at this moment I think we might uh, redo some tests again, like some scanning of your legs again, some blood tests. Okay, and also we might have to do some specific tests to find out that whether there is any condition running through your family. Okay, and what is it? There may be many conditions causing this, but we should be specific around about it. Are you getting me?
Okay, doctor. To be
Okay,
frank,
and after, yes, and after, once we diagnose it properly, what the cause of it, the cause behind this DVT, then I think we can be more specific about it. However, uh, we can be more specific about it, but however, uh, we will consult our blood specialist and also our consultant about it. But even if you are allowed to have a flight, then you should be aware of. Then you should take some precautions, like you can have some specific footwear, okay, and some specific footwear, and also I think you might take some blood thinning medication for preventive purpose, but this will be decided by the specialists. Are you with me?
okay.
And do you have any more questions?
Doctor, as you know my family tree, is there any possibility to transfer this to my children?
I can get it. Actually, for this purpose, we were eager to run some tests, some specific blood tests to confirm that whether you have this condition, which you have a condition running through families, and if this is the case, then we will be able to tell you whether you have any chance that you transmit it to your children. Are you with me?
Yes, doctor.
Okay. And do you have any more concerns or questions?
No, doctor.
Okay. So thank you, Mr. Hugh.
Thank you, doctor.
Okay.
Okay, time off, and you have 1 minute to think of your ideas. You can start if you like.
Yeah.
Okay, so you are suspecting that these patients have familial tendency for DVT or deep vein thrombosis. Is it right?
Yes, I am suspecting that.
Okay, so is there any condition that prone someone to develop this type of condition that runs in family?
Yes, I think so. There can be some specific blood level problems of clotting factors like protein C, sorry, there's some specific condition like protein C deficiency, protein S deficiency, and activated protein C resistance. I think factor 5 laden mutation. Also, there can be some systemic condition running through families. If I'm not wrong, I think homocystinuria can also be a cause here, which can cause clotting problems in generations, I think. And others, I'm not too much sure of it. I can't remember very much.
Any condition? Can you remember that you asked about his water work? Any condition that present with also DVT and
Yeah. There is, yeah. There can be a condition. I think PNH, paroxysmal nocturnal hemoglobinuria. I think
okay, that's
this
fine.
can this can cause.
And what are the any rheumatological condition?
Sorry.
Any rheumatological condition?
Yeah. Behcet's. I think
Okay.
Behcet's. Uh, Behcet's, and I just can't remember all those.
Okay, that's fine.
Uh,
And apart from the familial condition, do you think any other condition
uh,
or any other risk factors that was present on the first case?
uh, any other risk factor? Uh, no, I'm sorry, I can't get it.
Okay, no problem. So how will you investigate this gentleman?
I think at first I will go for some blood tests like CBC, ESR, and look at his platelet level, and also
Okay,
whether any inflammatory.
you said complete blood count. I think. Do you expect anything this complete blood count?
I think I would have a look. I would like to have a look at the platelet level in this patient, whether there is any thrombocytosis present or not. Okay.
Is there any condition that runs in family with thrombocytosis?
Uh, I I'm not sure about the polycythemia rubra vera. Not sure about it.
Okay, no problem. Then
Okay. Yes. And then whether there is any inflammatory or infective condition, so I think I would go for ESR CRP. Then to check again his blood vessels in the leg, in the lower limb, I would like to go to have a Doppler ultrasonogram of both legs. I would also
what do you
like to
expect
go
on
do.
Doppler?
Okay.
What do you expect on Doppler ultrasound at this?
Okay. If there is any actually normally it's compressible the blood veins, but if there is any symptom of DVT present, it can be non-compressible. I think that's important.
Okay, this patient had
And
history of DVT 7 years back.
yes,
And now, do you think that you are going? You need to go for again ultrasonogram or sonography, Doppler, study of his vein?
well, actually, regarding his long family history, I think that this might be needed. That he actually has several generations of his family involved, according to his history. So I would like to actually rule out those that whether he has any condition now.
Okay.
And also, I would like to do some other blood tests like D-dimer, fibrinogen level, and then some specific tests like protein C, protein S level, and then again to look out for those causes. I think uh, for Behcet's, I would like to have an autoimmune profiling, including rheumatoid factor ANA and other autoimmune autoantibodies, and also for PNH, I think I would also like to do some complement testing. I think And for homocystinuria, I cannot just remember the tests. I think these tests should also be done.
What should be the test for our protein C proteinase?
I can't remember. I'm sorry.
Okay, no problem. So, the center manual history taking was good initially. Initially, this you went on with a very good flow. That was
Okay.
totally fine. That you asked about his initial symptom, that symptom initially had any risk factors present at that time, and did he make any movement on the aeroplane, or was sitting stand still? Any pressure on more pressure over this area? That would be somewhat would give you better explanation that she was totally still during his journey. And after that, he voluntarily told that he had went through a dehydration stage. That was fine, and you asked for that. Any investigation was done at that time. That was fine. Okay. And other risk factor, you have searched for other risk factors, any carcinoma, any signs of PNAs, any rheumatological condition. You went for that. That was fine. And after that, you went for family history. Sorry, past history. Past history was somewhat fine. Drug history, that was also good. And in the family history, I expected that you would explore mass about his family history. That how
Yeah, I think actually I didn't ask about the ages, what happened. I
what
actually that missed.
at what ages those were diagnosed, and how they were diagnosed.
Yeah.
Was there any only suspicion, or just it was diagnosed after doing this test? Okay, there were multiple. That is, his brother had 2 times history of DVT. So, was there any test done to diagnose his condition, underlying condition? Okay, that would be fine. Just like this gentleman's case, and about asking about her family history, that would give you the better explanation, because his mother had a history of a stroke with, due to venous thrombosis. That is unlikely. Venous thrombosis cannot lead to a stroke unless there is presence of any cardiac issue. Okay. And also his grandmother had history of DVT. That can happen.
Yes.
Even there might be some precipitating factor that
Okay.
was present his family members, and also
Okay.
these members have some factors that precipitate this condition.
Okay.
After a long journey, it was not only after a short journey. There was presence other condition, dehydration, that could lead many onto this condition.
Oh, well, how could have I asked that? Dehydration or something like that?
He voluntarily told you. Though it is a family, you should you at least should have explored that. Was there any cause found for his brother? Does she know anything that why this has happened to his brother? So you could get a better idea that if there was because his brother had suppose had history of femur fracture, and during the hospitalization for 3 months, then at that time he developed DVT. That is that is a different issue. That we cannot take as familial condition. So
Oh, what? Sorry. Can you please repeat?
If he knows anything about this, if he knows anything that what happened actually in their case.
Yes.
Okay, except that everything was fine. Familiar condition, that was fine. And why did you ask for sexual history in this case? I cannot get it, that is it relevant or not. So I was just asking.
I was not sure that whether any long-term infective cause can precipitate this. I was not sure at the time, so I just covered it actually.
Okay. Yes, this management protein C and protein S level. We can measure that protein C and protein S level. Okay.
Yeah.
We can see protein C and protein S level. We can see the function of the thrombocyte.
Yeah, through risperidone test, I think.
And also, okay, our time is up.
Yeah.